in Estado de Roraima's in Brazil. So that being said and known, Guyana has partnered with organizations such as IOM, of course, our other international
Hi,
partners.
Oneka. Hi, Oneka. It's so great to have you back. I'm sorry to interrupt you, but we have to go
Hi,
live
Charlotte.
now. Yeah, we have to go live now. So I'll just ask you to hold your story because we definitely want to listen to you till the end. So when we'll start the live, when we'll start this global assembly, I will come back to you. Is that okay?
Oh, that is fine, Charlotte. It's good to hear you and everybody else. Goodness, good to be
Yeah.
back in telecommunications land.
Okay, so great. See you in a short while.
Very well.
Okay, so right now I think we are going to go live. And we are 5 minutes to the start of our global assembly. If you're joining us from YouTube, from Facebook, from LinkedIn, from Twitter, warm welcome to you. It's a pleasure for me, as well as my colleagues, to welcome to this final global assembly of the full learning cycle for the Movement for Immunization Agenda 2030. We have been together since the 7th of March 2022, and today it's our final global assembly. So just make yourself comfortable. Go ahead, type in your city, your country in the chat so we know where you're joining from. And in exactly 5 minutes, we are going to start. Okay, so I just want to say hello. We have with us here, as always, our guide on the side, Dr. Francois Gaz, that is with us, listening to the experiences of everyone. I want to say hello to Daudi Manyanga, that's joining us from Harare in Zimbabwe. Warm welcome to you. I want to say hello to Oneka, that's joining from Guyana. It's a pleasure to have you with us as always. I also want to say hello to Kingsley Ayo, that's joining us from Nigeria. Warm welcome to you. Hello also to Ugo Jovita from the Federal Capital Territory, Abuja, Nigeria. Emmanuel Musa, that's joining from Kaduna, Nigeria. So please just go ahead, type in the chat your city, your country, so we know where you're joining from. I also want to say a warm welcome to Dr. Clement Mukadi, that's joining from Chobe in Botswana. Warm welcome to you, Dr. Clement. And get ready, please get ready to tell us how you are doing, you know, what your experience has been like as a member of the Movement for Immunization Agenda 2030. I want to say hello to Boma Ikiriko, that's joining from Port Harcourt in Nigeria. Joseph Apia, that's joining from Ghana. Melese from Ethiopia, Addis Ababa. Surya Prakash Mishra, that's joining from Victoria in Australia. Wow, warm welcome to you. That's joining us today all the way from Australia. I also want to say hello to Jane Ade Kireme, that's joining us from Ghana. Warm welcome to you. In another 2 minutes, we are definitely going to start with today's Global Assembly. And as always, it's all packed. So much information, so much experience sharing. And we are going to be telling you what happens after the full learning cycle. Of course, you'll find out more about that during Teach to Reach Connect on Friday. And we'll also be talking to you more about that during today's Global Assembly. I want to say hello to Said Hussein, that's joining from Ethiopia as well. Warm welcome to you. And I don't want to forget those who are following us, those who have joined us via YouTube, via LinkedIn, via Facebook. Warm welcome to you. I want to say hello and warm welcome to Emanuela Chinyonye Odunze, that's joining from Nigeria, from Daniel Christiekwam, that's a clinical pharmacist joining us from the Upper West Regional Hospital in Ghana. Warm welcome to you from Daniel. And I also want to specially greet Joseph Ngugi, that's joining us from Murang'a County in Kenya. Warm welcome to you, Joseph. It's always a pleasure to have you with us. Pleasure to have you too, Ibrahim Abdullahi Maikano, that's joining from Bauchi State in Nigeria. Warm welcome to you. So it's so many people that are already in the room. so many of you that are here with us. I can't begin to go through all of the greetings that are here in the chat, but it's a warm welcome to you all from the Geneva Learning Foundation. And it's 5 p.m. in Geneva, and we are starting today's Global Assembly. So warm welcome to this this week 4 of the Impact Accelerator Launchpad. Is the 4th week of the Impact Accelerator Launchpad, and it's the final week of this full learning cycle of the movement for Immunization Agenda 2030. We started in on the 7th of March 2022 with the launch of this full learning cycle with gathering ideas and practices through the ideas engine. We then went ahead to have 4 weeks of situation analysis, and then 2 weeks of an action planning hackathon, and this is the 4th week of the Impact Accelerator, which started on the 23rd of May. So at the end of this assembly, like you have done in the previous week, you are going to go over to Telegram for the country group meeting. So you're going to be meeting other members of the movement that belong to your country. Together you can get to share your experiences, you can get to organize yourself, you can get to see how you can support one another. So just stay tuned and get ready for that. So right now, I would like to turn towards you who are here. We have been together since the 7th of March. What has it been? What has this experience been like for you? So I'm inviting you to raise your hand, and please do not forget to introduce yourself. You tell us what progress you have made since you joined the movement, but please start by telling us when you joined the movement and how has your participation helped you in your work. And I'm going to invite Dr. Oneka Scott from Guyana. If you can unmute yourself and please introduce yourself and go ahead and tell us what you have been doing since you joined the movement. Over to you.
Greetings, everyone. Thank you so much for joining the assembly. And earlier I was telling everybody, it feels good to be back in communications land. I am Onika Scott. I am the maternal and child health officer at the Ministry of Health, Guyana, with responsibility for immunization, maternal health, and of course, child health. I've always said this, and it's really been impactful to have this connection. I believe that you will be seeing more people joining from Guyana, since at our last DPI meeting about 3 weeks ago, we were able to present on the movement. But let's talk a little bit about my action plan. So for Guyana, my situation posed a challenge of accessing migrant populations that are coming from territories where there are cases of measles. In Guyana, we've not seen one case of measles in over 35 years. So we're glad to have, at least as a country in the Latin American and Caribbean region, to have elimination status. The problem, however, with migrants that are coming from Venezuela and Brazil is that there have been active cases in those countries, and our borders are extremely porous. So border traffic is not as organized as it should be. That being said, when migrants enter our hinterland areas and our interior, they settle in areas that sometimes are very remote and are very far from the health facilities. So our Immunization Act and laws in Guyana affords the healthcare workers the right to offer vaccines to anybody who's entering our territory in order for our population to be protected. We do strongly believe that it's easier to prevent than treat, especially if you look at all the macro and microeconomic factors involved in responding to an outbreak. As part of my situation analysis, and I do have it pulled up in front of me since we've been marking the areas that we have been able to complete, we looked at advocacy, although we've partnered with organizations such as IOM, which is the International Organization for Migration, and we do have UNICEF and PAHO, who are strong partners leading our effort in ensuring that migrants in remote areas are accessed to offer immunization. We do want it to strengthen our capacity in those regions, those hinterland regions, to deliver the service of immunization. So I took that opportunity to write that down in my situation analysis. And in my situation analysis that I submitted, we looked at what immediate approaches I would take and lead, what the long-term approaches were. So in the last 2 weeks that we were away in the hinterland area, we were able to complete a few things listed on the those next actions in the situation analysis. I was able to convene local meetings in Region 1 along with the regional health officer. We met even with civil society to help us to flag some of these migrants, unsanctioned population as they come into the territory and they settle so that we can plan to go to them. We were also able to plan through my budget. The region was able to submit to the ministry 2 proposals for exploration into territory that is still uncharted. Not even miners are located there. But what is happening now with our intervention, and this is one of the things that I also listed as a recommendation, the miners and the farmers that are remotely going to those areas, whenever they have sightings of migrants, they're now channeling it to the healthcare system so that we can mount a response to plan a health outreach. It may seem like a lot, and there are a lot of resources involved, but it's one of the ways to strengthen the community platform so you have everybody singing from the same hymn book to understand that immunization has to be high on our agenda if we're to protect our population. And one of the final things I was happy that we were able to do is to take the opportunity last week in the hinterland to conduct training with our CHWs, talking about some of our strategic plans as it relates to migrants and immunization, strengthening the data collection tool. We separated migrants that were re-migrants because they are Guyanese that were living in Venezuela, and some of them were born to Guyanese parents. And so we're able to now divide how we're capturing the immunization data so that we will, based on the information that comes in from the immigration authorities, know what our dropout rate is. Given the fact that migrants who are coming from Venezuela don't usually stay in the same location, they traverse the country, we're working with the immigration authorities rather in those local regions to build a registration system that is a little bit responsive to the healthcare system so that we can kind of correlate data to see where we have to go. Right now, and this is finally, Guyana is in budget period for 2023. So with my situation analysis, and this is one thing I added after I submitted the situation analysis to the Geneva Learning Foundation, I added that we needed to incorporate in our 2023 budget hardcore activities that the government of Guyana will pay for so that we plan systemically to go to those areas to explore. It was done during COVID-19 and for COVID-19, but the emphasis needs to be strictly there, and it can't just be from the government of Guyana's budget. It has to be that we incorporate partner funding and partner support. So when I shared my situation analysis with a little bit of tweaks and edits, of course, with our partner organization, PAHO, and we're meeting with UNICEF to share at the end of next week, they decided that they would add a few activities to what we recommended at the ministry that we could do, and we would streamline a plan going forward for the end of 2022. Charlotte, how much time do I need to complete my situation analysis?
Thank you so much, Oneka. I would like to, before we move forward, I really want to turn towards Dr. Francois Gaz to hear if he has any comments or questions following. I think we have had the gist of all that which you have been doing, which is quite great. And so I would like to, I really want to hear Francois' thoughts on this.
Sure.
Francois?
Yeah, thank you, Charlotte, and hello to everyone on the call. I think what you're doing is quite impressive because you seem to be already a very seasoned manager and leader in your area because you focus on your issue. You identify the migrant, you try to register them, you use all the local partners to do that, and you develop strategy to reach them. And you have already identified sort of critical element that allows you to develop strategy to reach them? And you say you have from Brazil, you have from Venezuela, some are staying, some are coming and getting back, and you seem to be mastering with your situation analysis most of the problem to get there. So I can only congratulate you for the process you're using. Now, my question is, what size of populations those migrants represent in your district?
Oh, that's a very good question. And that's particularly why the situation analysis was important, because we have registered about 4,000, but we rather suspect that there are just about double that amount. The problem is locating them because of where they go in. I should mention one thing, though. The migrants are an indigenous Venezuelan tribe. That's what we're looking at. Those are the Warao tribe. So even though they speak Spanish, it's not Spanish that's, from Spain. It's a little bit twisted. And so we have indigenous people in the region that they're entering. So it is it's to say that indigenous population is already nomadic in nature. They're already migratory in nature. So it's hard now to really register how many, since they're at one place today and then another place tomorrow, looking, of course, for resources to survive. I take this opportunity because I'm now looking through one of the things that in green that we completed. We were able to also start the process of procuring signage so that we put them up at some of the border areas that direct the migrants to the care of the health facility. The difference with this signage is it is in their language. Guyana is the only country in South America that speaks English natively, and we speak no other language. So to have those signage done, it's not done in English. It's done, of course, in the Warao language, how we interpret it, and in Spanish.
One additional question. You mentioned that you were free from measles, and suddenly you get measles case.
No measles case so far. We're trying to prevent.
You trying to prevent?
Right. We've been free 35 plus years.
Yes, I saw that there was a beginning of one of you cases coming from Brazil or Venezuela.
Yes. And that's why Guyana has more than doubled our efforts to protect our border areas. So if you're coming into Guyana from Venezuela or the regions in Brazil that active outbreaks have been reported, you must show proof of measles vaccination, or you must be vaccinated on entry. That's why it's important for us to incorporate our approaches to find the migrants to immunize them against measles. And if that makes any sense.
I've never dealt with a migrant, and the word is migrant. That means they move all the time. Is it something you still missing some group, or you have developed an understanding of the pattern, the way they move?
No, we are
during season, or what are you doing to find them?
No.
Because
Right. Good question. We are missing many groups. They're, like I said earlier, the problem is that when they come into the territory, our borders are very porous, so you will not have immigration stations at all of the places that they enter. So when they come into Guyana, they enter more remotely in our Amazon. And in those Amazon areas, there is nobody living there. So unless there's a minor company passing through, and when the miners now see them, they're able to communicate back inland to the health authorities to say you have a population of 40 or you have a population of 100 migrants in a non-sanctioned area. So go deliver health care. And one of the things that the situation analysis was able to strengthen, because Guyana had done this before, but because of the pandemic, we had, somewhat slacked off. We were able to, in our last 2 weeks in the region, we were able to emphasize that it must be a multi-sectorial approach, not just immunization, but let's use the opportunity to offer different services to them, just health screening to make sure that the populations are healthy, and so that the populations know that in Guyana, access to healthcare is free, so they can be treated for the chronic illnesses or any other infectious illness that any of the populations may have. I'll add to the situation analysis, Charlotte, that we want to partner also with other social entities to offer things that are tangible to them so that it will act as a lure to immunization care. And I use that word.
Yeah, just the last point. I think it's your story is fascinating, and you really are grabbing all the elements, because in many countries, when the disease has disappeared, like measles, when it has disappeared, why is the need? Why do we need to be immunized? So it's not a very attractive pushing intervention when you have not seen measles for quite a while, 35 years. You wonder, why should I get immunized, get my child immunized? How do you, and I'm hearing now that you do a very attractive approach where you offer them what they look for, what they will be looking for, like free services or health facilities, and you drive them to those facilities. And that's quite fascinating. And did you have already some beginning of a success, or are you going to look for it, the success story?
I'm sorry, I didn't understand the last.
Are you already seeing some positive results, or are you still in your situation analysis and developing the strategy that you're going to get funded with your plan?
Well, for the past 2 weeks, with the activities that we embarked on, we were able to conduct, like I said before, 2 outreaches, funding that I was able to make available to the region to do so, although we accompany them. But I think that the success and the impact will be seen as long as we're able to generate more resources to come on board to kind of build census, where they're located. Let's register. Let's have temporary health huts there, which is what the government, by and large, will have to work on at some point in time. And I think the impact of it will be seen in about another 2 years, when we're able to measure how many of them we were able to capture based on the amount that were actually registered through the immigration system. And those are the parameters that we were able to establish last week. How do we know whether or not this situation analysis will be successful? Of course, it's not the only thing we can do to ensure we capture the migrants. Other stakeholders will have to play their part. But what is it that I can do? And these are the parameters that we put forward. And so we continue to plan for the outreaches. We continue to factor in our budget next year that we have to have many different outreaches based on the surveys that they're conducting now. So if one part of the region usually has a record of probably 20 different populations moving towards that region, we know that we have to plan for about 25 different outreaches in the course of 2023. And that's what's impacting my budget planning at the moment. Maybe in about another year or two, I can answer your question as to how successful it is. But the community platform is definitely one of the measures I want to utilize to reach these vulnerable populations.
This is excellent. Thank you very much.
Thank you, Dr. Francois Gaz. Thank you, Dr. Oneka Scott. We have to move on, and I'll be inviting you, Oneka, if you can take a look at the chat. There are some comments and some questions that if you could respond to those directly in the chat, that would be great. So if you want more of this, I just want to invite you for Teach to Reach Connect on this Friday, because that is our biggest experience sharing event. And you are going to, during Teach to Reach Connect, you also get to know what we have in store as far as the next phase of the movement for Immunization Agenda 2030 is concerned. And talking about Teach to Reach Connect 6, it is going to hold this Friday, the 17th of June. And officially, during that event, we are going to be closing this first full learning cycle of the movement for Immunization Agenda 2030. And we already have over 12,000 people registered. We see 6,398 Anglophones as at this morning that were registered for Teach to Reach Connect 6. But you can still share, because Teach to Reach Connect 6 under the banner of One Health, we are not only limiting it to immunization professionals, but to all primary healthcare professionals. So you are invited. I've shared some links in the chat. If you can go to those links, you click on Twitter, Facebook, LinkedIn, depending on the platform that you are most familiar with, that you most used widely. Click and share the announcement for the event, so that members of your network, your colleagues and friends in primary healthcare will be able to join. And as I said earlier, it is and it is an event packed Teach2Reach Connect session that we are going to hold this time around. For the first time, we'll be partnering with UNICEF to hold a global event on COVID-19 vaccine demand. It's the Vaccine Confidence Summit that is coming up from the 22nd to the 23rd of June. But in prelude to that, there is going to be a special session a special plenary session at Teach2Reach Connect 6 that is focusing on COVID-19 vaccine demand. And you are all invited to be a part of that special plenary session. Once again, the women who deliver vaccines are going to be honored during this edition of Teach2Reach Connect. And I'd like to see if there is one of the founding members in the room to tell us what Teach2Reach, if you're a founding member of Teach2Reach Connect, of the women who deliver vaccines, movement collective. I just want to invite you to raise your hand. So last March, in honor of the women who deliver vaccines and in celebration of the International Women's Day, we had a special event on the 4th of March. It garnered a lot of interest, so much so that we were able, over the past 2 weeks, to hold, in partnership with Gavi's Zero Dose Community of Practice, to hold 2 webinars around gender barriers to immunization. The first one was on social gender barriers to immunization. The second, during which we had presentations from some of the women who deliver vaccines, was on structural gender barriers to immunization. And we are going to be closing this special event series with this event on Friday for women who deliver vaccines. But it's not only women who will be coming to share their experiences on what they are doing to overcome barriers, gender barriers to immunization, but also the men are invited. So add that to your calendar and make sure that you are part of this plenary session. And then last but not the least, for other primary healthcare professionals, we are going to be having a special plenary session on the neglected needs of women's health that is focusing on female genital schistosomiasis. This is a neglected tropical disease that affects over 56 million women in sub-Saharan Africa. And we are going to have a specialist in infectious disease like Dr. Julie Jacobson. That will be part of this special session guide on the side. They'll be joining with Dr. Amadou Garba for the French Francophone session on Friday. So to make sure you join, you'll be listening to experiences that are shared by participants who are involved in the fight against female genital schistosomiasis in their context. So I would like to invite you to take a good look at what I'm sharing right now on the screen, because Teach2Reach Connect is on 2 platforms. It's going to be in Zoom for the plenary sessions, but the networking sessions where you get to discuss one-on-one with health professionals from all over the world is taking place on the platform that we call Hop-In. So please, and for you to access Hop-In, you need a ticket. It is a free ticket, but you have to go to your mails, check on this on this mail that says get your ticket now for Teach2Reach Connect. Here you'll see it's the name of my colleague Zah, but it will be your name on that mail. So you click on the red button, click here to get your Teach2Reach Connect ticket. So the ticket is free. It's like your access pass to the conference, and it's free for all country-based health professionals. So once you click there, you'll get this page that's asking you to register. So you click here to register, and then you choose the ticket that you want. It's going to be English country-based health professionals. If you're bilingual, you may click on the first ticket that is showing there, and just follow the instructions so that you can get to enjoy networking during Teach2Reach Connect 6 on Hop-In. Now I'm going to turn towards you. We have 3 networking sessions during Teach2Reach Connect. The first networking session will be on how I overcame challenges to improve healthcare in my community. And the second is on what I am doing to build confidence in COVID-19 vaccination. And the third networking session is how I am challenging gender barriers in healthcare. So I'm going to invite you right now to raise your hand if you want to tell us which networking session you are most interested in and what you will share with your colleagues. So I'm seeing Asma Bashir. Your hand has been raised for a while. Are you able to unmute yourself to tell us which, if not, I'm also going to ask Tracy Kirote, if you're able to unmute yourself to tell us which networking session you would like to you are most interested in, and what you want to share with colleagues. Tracy, are you able to unmute? If not, I see Samuel. Okay, Tracy, you're unmuted. We'll start with you.
Hi, Charlotte. My name is Tracy. The networking session I'm interested in sharing with my colleague is the first networking session of how I overcame my challenges to improve healthcare in my community.
Okay, and what are you going to be sharing with them?
I'll be sharing a link about the immunization action, the global immunization action IA2030, and invite them to join us. And I will also take my colleagues through the journey of how I started and how I even learned about the responsive feedback and how it has helped me personally.
Okay, thank you so much, Tracy. Over to you, Samuel.
Yeah, thank you very much. Greetings, everyone, colleagues, and all partners who are in this meeting or in this forum. Yeah, I will be interested in networking session too.
Samuel, please introduce yourself.
Yes, please. I'm Samuel Malugai Badiekan. I'm from Ghana. I'm an alumni for the Geneva Learning Foundation, the IA2030. I also started with it. So I'm also one of the members of the movement, IA2030 movement. So looking at it, I'll be interested in the networking session too, on what I'm currently doing to build confidence in COVID-19 vaccinations. Yeah, currently what we are currently experiencing here is that sometimes we have some people who are actually not interested in taking their vaccinations. But we've tried to find out why some of them are doing that. On a lower side, we've observed that some is due to personal reasons, and some of them is due to some information that they've heard concerning the COVID-19 vaccines that is no good. That's why they are not taking it. However, we would like to have a deeper in-depth of understanding as to why people are not willing to some people are not willing to take their vaccinations. And then apart from why they are not willing to take the vaccinations, we also like to also find out what if we do as a health system will make them want to take the vaccination. So that's side that I want to share. And as a way of trying to understand this, we are already taking a research as part of our region. That's what we are doing now to understand some of these barriers, and then looking at other opportunities that we can take to overcome them as a region to improve upon uptake of COVID-19 vaccinations.
Thank you so much, Samuel. And we are going to close with you very quickly. Melese, over to you.
Thank you, Charlotte. Thank you, scholars, to give me the chance to share my interest in which networking session I will be involved with. So networking session 2 is interesting for me, as well as other sessions are very important, especially in our country. But to take one, session 2 is very important for me due to the current challenge of COVID vaccine resistance. Yeah, I will share with my colleagues and healthcare professionals about the responsive feedback that's already very important to just for implementation activities. And also I will share this rich connect that help us to communicate in different professionals in the globe. Yeah, thank you.
Thank you so much, Melese. And also at Teach Rich Connect 6, as I said earlier, we are going to be having 3 plenary sessions. The first plenary session will be on how we build confidence in COVID-19 vaccine. The second, you'll be listening and learning from the experiences of women and men who are challenging gender barriers in immunization. And the third will be on the neglected needs of women's health, focusing on female genital schistosomiasis. So I'm going to be asking you this question again. So which plenary session are you most interested in and why? So please go ahead and raise your hand. If you're unable to speak, you can as well answer the questions in the chat. So I'm going to turn towards Esiani Anthony, your hand is raised. Please go ahead and unmute yourself to share with us the plenary session that you are most interested in and why. Okay, I'm going to ask Fanny Ogu. Fanny, are you able to unmute yourself? Fanny Ogu, your hand was raised. If not, I'll take Adamu Galadi.
Hello?
Yes, Anthony, over to you. And please do not forget to introduce yourself.
Okay, my name is Ezan Anthony. I'm an ambassador in universal health coverage here in Nigeria. I work with African Leader Malaria Alliance. Also participate on immunization. I want to go to preliminary section 1, how we build confidence in COVID-19 vaccines. What I have been doing since we started this program, that I have taken a campaign to some secondary school and primary school, and also in community level, able to train them, and also including the COVID-19 protocol. And I also have to make confidence to them that the vaccine being given to the world was able to come out from World Health Organization, UNICEF, have already been tested and approved. So they will not have any other means of rejecting it. They should need to come out to vaccinated so that it should be prevented from future occurrences. I'm able to reach some of the, disseminate some information, mostly to some traditional rulers. Able to talk to them that they should have confidence, but they should bring out their people from their village. Also able to inform them that the vaccine is going around. They have to take that. You know, everybody needs to go and be vaccinated so that it will not be able to result in disease outbreak in the future. So that's what I'm doing. And also, I went to my local government and meet some organization of officials and their colleagues. I told them about the session that are coming up. I need their assistance if time comes, that we are still learning, we are still studying, and we soon round up. So all of them, that was amazing about the development. Thank you.
Okay. Thank you very much, Esiani, Anthony, and Fanny. Since your mic is already unmuted, over to you to briefly tell us which plenary session you're most interested in and why. And please do introduce yourself.
Okay. Good afternoon, everyone. I'm Fanny Ogu. I'm a nurse epidemiologist. I recently retired from services of Federal Ministry of Health as an Assistant Director of Nursing Services. The plenary section that I'm interested in short, just the three, but the primary one would be plenary number 3, neglected needs of women's health. That's the female genital schistosomiasis. Why I'm interested in this is that I am from a community where the dwellers, up to this moment as I'm speaking with you, they still fetch water from rivers because they don't have means of water supply. In the entire community, they have like just 2 boreholes that cannot service everybody. So children still travel distances of about 5 to 10 kilometers to fetch water from flowing rivers. So I'm interested in this because we are in the belt of a female genital schistosomiasis. Thank you very much.
Thank you so much, Fanny, and look forward to seeing you on Friday for plenary session 3, during which you'll get to hear experiences from health workers that are actively involved in the fight against female genital schistosomiasis. We are just 25 minutes to the end of our Global Assembly for today, and we'll have to move to the next phase. And last year we asked this question: what is the future of immunization? That led to the creation of the movement for Immunization Agenda 2030. And so far, we are now a community of over 45,000 immunization professionals from around the world that are connecting together across countries, across regions and system levels. And in last March, we launched the full learning cycle for the movement for Immunization Agenda 2030. And it was a series of activities moving from ideas generation towards action plan implementation. And so far, 4,803 Anglophones and 3,574 Francophones, making 8,377 immunization professionals have joined the movement for Immunization Agenda 2030. And like I said earlier, we started with the IDS engine, and right now we are going through finishing the 4-week Impact Accelerator launchpad, and over 4,000 of the members of the movement signed up to join this Impact Accelerator launchpad. From the 9th to the 20th of May, you developed an action plan, and we asked you this question at the end of that process. You have developed an action plan. Are you ready to take action? Are you ready to actually transfer what you have developed on paper to actual results on the field? And many of you answered yes to that. But if you are here and you have not yet completed your IA2030 action plan, you still have the opportunity to do so. I'll be inviting you to click on this link in the chat and complete your action plan. If you have not yet done so, you still have the possibility to do so. But for those who joined the Impact Accelerator Launchpad, we ask you to do 2 things. Every Monday, you set your action to complete by Friday. You set the action that you want to complete by Friday. That was what was expected of you every Monday, and today is Monday. And if you have not yet set your action for week 4 of the Impact Accelerator Launchpad, I am just inviting you right now. If you can do so, that will be great. And every Friday, the second thing you are expected to do is to tell us how your week went every Friday, how your week went. And this particular link also enables us to look at the community barometer. That shows us there are a series of 5 questions asking you how you are doing, what your experience is like as a member of the IA2030 movement. And over the week, we have been seeing there has been a steady increase in terms of how the participation in the movement is affecting your social connections. Participation has changed, it's changing you as a professional, it's helping your professional practice, has made you to see your world differently. And we see that last week, there was a slight drop. I don't think this one is statistically significant, but just to show you that on a weekly basis, we are trying to measure how the participating, being a member of the movement is helping you in your work, is helping you as an individual. So in terms of experience sharing, we know since the start of the movement, we had every week experience sharing sessions with Dr. Francois Gas and myself. So this week, there won't be any experience sharing session, but I'll be telling you, gather your experiences for Teach to Reach Connect. When you'll be connecting with other professionals on a one-to-one basis during networking, you can get to share your experiences with them. But I would like to honor the 49 scholars that shared their progress with us for week 3 of the Impact Accelerator Launchpad. And I'll be turning towards you right now, inviting you. If your name is on this list and you are in the room right now, I'll be inviting you. Let me lower all hands that are currently raised. And I'll be inviting you to raise your hand if you want to answer the questions that are on the screen. We are asking you to tell us how your week went. But you start by, first of all, reminding us your goal for June 17th. And then tell us if you completed your week 3 action, what happened, how it turned out. If there's anything that surprised you, would like to share, if you have a lesson to share, any lessons you may have learned, success stories, or a particular challenge. And then, of course, you end by telling us what your action is for this current week and how will this action help you to achieve your goal by the 17th of June. So inviting you right now, if you can go ahead to raise your hand. I see Matthias to raise your hand, and I'm seeing okay, I see there are already 2 hands raised. I'm going to start with Florence Dairy. Florence Derry, are you able to unmute yourself? Florence Derry. Okay, and or I see some other hands have automatically gone down. So, okay, Florence, your mic is unmuted. Over to you.
This is Florence from Ghana, a community health nurse, now a midwife. I work in a health center. From the beginning.
Yeah, when did you join the movement?
In April.
Okay, yeah, so please go ahead and answer the questions on the screen.
Okay, my goal for June 17th, 2022 for the Immunization Accelerator Impact was to educate my community members about the COVID-19 vaccine because of the vaccine hesitancy. And that was the goal I chose. My challenge was vaccine hesitancy. For the first week, I was not able to achieve, and so I continued for the second week, and this is my third week. I'm still on it. What is happening now is we have been able to talk to mothers or caregivers who come with their children for weighing. We talk to them and give them the immunization, the vaccine jabs. Then we've gone into the community daily to also give the jabs. We've spoken to the opinion leaders. And then because some of the people are traveling out for the pilgrimage, especially the Muslims, it has become compulsory that they get the vaccine. And some of them really hesitated in taking it. And then we had opinion leaders who were able to talk with them. And then we also gave the vaccine to health staffs, administered it right in front of community members. They stayed with us for about 30 minutes. Nothing happened to them. They really believed in the vaccine. After we have created the confidence in them, and then we administered the vaccine. So for now, we are getting the numbers coming up. We also did publicity from house to house in individual target areas. We have gone to the schools, giving them letters. Some people resisted, and then so we asked that parents should consent before the vaccines will be administered. And now we have also extended it to the pregnant women. Anybody who visits the facility will not go out until you take the vaccine jabs before you go out. And that has increased our coverage for some time now. For the whole of last week, that has been the action plan that we are working with.
Okay, thank you so much, Florence Derry. I'd like to turn towards Dr. Francois Gaz, our guide on the side, if he has any questions for you.
No, thank you, Charlotte, and thank you, Florence, for taking the floor and sharing your challenge. I think what I appreciate is your obsession in getting what you plan to do in spite of the problem that you face the first and second week, and you're still moving. And that's very encouraging that you're now starting having some results about addressing the issues of vaccine hesitancy in your communities. And I think not giving up is really a critical skill and competence in all what we do, because we know that's not easy depending on the environment. So congratulations for pursuing your goal on vaccine hesitancy, and I'm looking forward to see, I hope that you get some progress over the coming weeks after getting into the communities and managing to talk to, educate them on the vaccine, the benefit, and talking to mothers, to influencers, etc. So thank you very much for sharing.
Thank you so much, Francois, and thank you once again, Florence Derry, So I'm going to turn towards Dr. Kaushik-Nag. Dr. Kaushik-Nag, your mic is unmuted. Over to you, and please do not forget to introduce yourself.
Hi everyone, I'm Dr. Kaushik-Nag, working as faculty committee medicine in Tripura Medical College, India. My goal was, the challenge was fear of AFI among adults, and the goal was to conduct some sensitization training on AFI for the interns, healthcare worker, and I conducted it last week and it went well. We had some hands-on training on the AFI report format, and we also included Department of Pharmacology. One person was there, pharmacovigilance officer. He also showed how to fill up the form of AFI. And next plan of action is to conduct health education session on AFI by the interns, and it will be conducted in the rural areas, and community people will be invited, and all these are done will do to increase the awareness of people regarding importance of immunization, as well as we will try to reduce the fear of AFI. If there is any fear or any myth, as we heard in the last meeting by some healthcare worker was telling that somebody thought that if their baby was pierced or if they penetrate the skin, then there will be some there will be signs of a devil's eye. So they were reluctant to take the vaccine. So these are few issues which came up, and plan is to conduct multiple health education session every month, so that gradually we can decrease the fear of AFI, and also if there is any misconception or myths regarding immunization, we can reduce and we can improve the immunization coverage. Thank you.
Okay, thank you so much, Dr. Kaushik-Nag. Before I turn towards Francois, I'd like us to listen to one other person, Adamu Galadima Dagona. Adamu Galadima Dagona, are you able? Your hand is raised. Okay, over to you.
Yeah, good morning all the facilitators and the mic scholars. I am Adamu Galadima Dagona from Federal University Geshua, a medical microbiologist and parasitology. In fact, my own goal is to determine the vaccine hesitancy among the adults in my local facility. So in fact, for the first time, I set the goal on the advocacy sensitization for the kick-off program for the first week, and it was successful. While secondly, we look on to it, we forge ahead and start. I have structured a questionnaire that will determine the number of responses that we may think that the people have in order not to agree with the vaccine. So we structure about 20 questions, both the questionnaire and that for the interview. Those that cannot be able to answer, then we subject them to put in writing to answer in the questionnaire. So we are able to collect all those data for the second week So now we are in touch. We will try to gather all those data that we collected and analyze them and see what are those factors that really affect the people from not agreeing to accept the vaccination. So there are many, there are so many studies that have been conducted about vaccine hesitancy, but it depends on the part. It depends the root cause. We just want to know the root cause of the vaccine hesitancy among the different community. We subjected about 3 facilities. For the first time, the challenge that I've just faced when I'm conducting the advocacy visit within the facility that we are, more especially the federal investigation that is selected among the facilities that we are going to take those data. But unfortunately, we are on strike. The teachers and the health workers, they are all on strike. But I switch off in order to identify another facility within the local government area. Then I'm able to have the 3 facilities, and we have used a kind of multiple kind of study method and structure questionnaire and interview to collect all those data within the 3 facilities. So this is the challenge that so far, but I'm set up the goal. We are trying to accept before the end of the we analyze the data that we have just collected and establish what are those factors that at least contribute to the vaccine hesitancy in the area, because it depends on the nature of the area that you're conducting the research. It will be different from this country, from this community to others. Therefore, we on our own part, in trying to instill, in trying to inject the spirit of the successful vaccination, and that of the more especially the acceptance of COVID-19 within the community, when we have that root cause, then we can be able to have them in order to address them to achieve the immunization agenda that we intend to achieve. So this is so far what I have done.
Thank you, Adamu Galadima. What motivated you to want to carry out this research to find out the factors that contribute to vaccine hesitancy in those particular communities?
Yeah. Really, a lecturer concerned that, and we are working hand in hand with them, the facility, that is the facility. I always used to go to them in order to help them some of the things that laboratory tests and others. Then I tend to see here and there other people, they want to take the vaccine and others, they don't want to take it. When I'm trying to just mingle, I've even conducted a kind of an analysis to understand how many people that have taken the vaccine, at least randomly like this, and why are they not wanting to take the vaccine. So I've been able to establish some of the things, but I just say that is very important in order to set up the goal, in order to know the root cause of why the people visiting those facilities are not very much confidence in taking the vaccine. So there are many factors. Maybe the fear. Some of them, don't have confidence, maybe the potency or fearing of reactions and others, but that cannot be able to give us the determining factors, except we conducted all those kind of a study in order to establish the fact. That is why I want to participate in that, in order to reduce the number and also to enlighten people as a kind of medical microbiologist. So most of the people, at least when we talk to them and explain to them there is no any harm, no any kind of side effect for taking the vaccine, then most of them, they can be able to be convinced in order to take the vaccine. That is why I prompted me to go into vaccine hesitancy in that facility.
Okay, thank you so much, Adamu Galadima Dagona. I'd like to, Francois, just any questions or comments for Dr. Kaushik Nag or Adamu Galadima?
Thank you, Charlotte, and thank you, Dr. Kaushik. I think you're establishing an AFI reporting system where you detect, you prepare forms to be filled, you report, and you react. This is a system for F5, and I think it's very important. What you're doing is extremely important, because side effects are sometimes misanalyzed on being caused by the vaccine when it is not. And so putting a system, in fact, we reassure people that you are on top of things, and then you analyze all the data, and you have, like they call, a responsive feedback in a way. If you find a case, you react to make people understand it's a minor or it's not due to the vaccine. We have heard many misdiagnosed AFI following immunization that can be due to fever, to malaria, or other things. So I think it's a system which is critical to keep the vaccination program working. In terms of Adamu, I think I want to congratulate you to pursue your situation analysis. Your plan of action is to go to the root cause of the vaccine hesitancy, and this is an excellent first step. You need to find, and you have established a questionnaire, and you're going to interview the people to listen to them, to find what's the cause and what's the root cause of their vaccine hesitancy, in order to adjust, to tailor your response and the information they need to have to be reassured about the vaccine. And I think you show some flexibility. In spite of a strike, you move to another facility, and this like a little bump, and you're moving to the next facility where you will have your you can collect the information that will still be useful. So I think it's an excellent plan of action. We need to, I think the understanding of situation will make you successful at the time you implement your corrective measure, because it will be tailored to what you have learned. So congratulations and good luck for completing your plan of action with the analysis.
Okay, thank you. Thank you once again, Dr. Koshigna. Thank you, Adamu Galadima Dakona. And thank you most of all, Francois, for that feedback. And you're also receiving the appreciation from the participants, the presenters in the chat. All right, so we are going to move forward. And like I said earlier, the next phase of to find out about the next phase of the movement, I encourage you to join us on Friday at Teach to Reach Connect 6. And before I move forward, I know, like we said earlier, there are no more experience sharing sessions program for this week, because we have a mega experience sharing session on Friday. That is Teach to Reach Connect 6. But I'd like to turn towards my colleague Zah to talk a little bit. I heard in some of the experiences shared, participants talk about responsive feedback. So I'd like to invite Zah to tell us what is next for those who participated in the responsive feedback with our partner, The Curve.
Sure, thanks, Charlotte. So during Teach to Reach, there will be a special session dedicated to responsive feedback. And I believe many of you in the room are actively taking the module. So it's a quick online module on this approach, on how to use it to actually improve the field implementation that you're focusing on right now, but more broadly for future programs or interventions that you will carry out in immunization or in other areas of health. So during Teach to Reach, if you have not done the module, this special session will be a unique opportunity to learn more about it and to hear how other colleagues who have done it, how it's helpful to them and how you can use it to support your own work. And for those who have completed the module, I think it would be a great opportunity to share your experience. Especially, I've heard earlier Tracy, for example, who has shared it's been helpful. So that experience, I think, would be great to hear from you, Tracy, and others, and also to learn why exactly it's helpful. And so what Charlotte is sharing here now is the title of the special session focused on responsive feedback. And obviously this is an approach that has been designed by Professor Vish at the Harvard University, focusing on supporting frontline practitioners like you to improve program outcomes. So I'll leave it as that at that. And Charlotte, back to you.
Okay, thank you very much, Zah. So you have just shared some relevant links in the chat. If you want the direct link to the session, so you can add that to your calendar. Just follow the links that I put in the chat. And earlier on, I saw a question by a member of the movement asking whether they'll still have access, even at the end of the full learning cycle, they'll still have access to the IDS engine. Yes, you continue to have access as a member of the movement to the IDS engine and to the ideas in the IDS engine. You can always continue to consult them because many of you identified more than one challenge. You know, said you were facing more than one challenge, immunization challenge in your context, in your day-to-day work. So after solving the current challenge, you can decide to tackle the next one. And for you to tackle that, you may want to go back to the IDS engine to see ideas and practices that have been used by immunization professionals in other contexts to tackle the same challenges. So the IDS engine will remain open. But I saw Ian Steele is in the room with us. He puts up the IDS engine. Ian, I hope I am on the right track by saying this.
You are indeed, Charlotte. And everyone is extremely welcome to continue using the ideas engine. And I noticed that new ideas are being published, new people are joining, and we're still there to support you with that.
Okay, thank you so much, Ian. As you heard, you can continue to add your ideas as you are innovating, as new thoughts are coming to your mind as to how you can solve the day-to-day challenges you face in your context. Do not hesitate to use the ideas engine to add those ideas or to consult the ideas engine for ideas and practices that can help you. So right now, we are almost at the end of today's. In fact, it's already 6 p.m. in Geneva, and we are at the end of today's Global Assembly. But as you all know, there is one thing we do at the end of each assembly, that you get to meet scholars from your country on Telegram. So I'd like to invite you right now to move over to Telegram. Right, Zha and myself will be there to launch the video calls in your Telegram group. You just go ahead and type. If you are ready, you can just type. You go over to Telegram and type that you are ready in your country group, or you can also just go ahead and type the name of your country right here in the chat, so that we can move over to Telegram and start the meeting for you. And if you are new and you don't yet have the link to your country's Telegram group, I'm just going to share the link with you right now in the chat. Is the link to a Word document. You go ahead and download that document and click on the link that corresponds to your country group, your country Telegram channel, and go over there. So I see Nigeria. You just type Nigeria in the chat. So I'm going to move over to Telegram and launch the call for Nigeria. And once 2 people have joined the call, I will leave and go to another country group on Telegram. Okay, I see Zha is already has already opened up the room for Nigerian scholars. So Nigeria, please go ahead and join so that Zha can move over and open the room to another country group. I'm going to go over now to India. I see India, you have indicated in the chat. So I've just opened the room for India. As soon as you joined your country group, India, and you join the Telegram, the video call, I am going to move to a next. I see one person, Bala Ganesakuma, has already joined the call, the video call in Telegram for India. So I'm waiting for one last person, and then after I'll move over to Ghana. So if you can, so I'm calling on Indian scholars, if you can join. Let me see if I can invite. So I'm going to just go over to Telegram and I'll share my Telegram. So I'll share my screen and I'll share what my screen looks like on Telegram. Okay, so I hope you're able to see that. And so there's a live stream of Indian scholars. I see, okay, a good number of them have joined the room. So I'm going to leave. I see Bala has invited some colleagues to join. So if you are online, go ahead and join. So I'm going to move over and start the call for Ghana. Okay, I see Zha has already opened. Ghana is already ongoing. Let me see if Cameroon English is there. So if there's anyone from Cameroon, I've launched the call. So go ahead and join if you are from English speaking Cameroon. So if you're from English-speaking Cameroon, please go ahead and join. Okay, I see someone is indicating Kenya in the chat. So I'll just go ahead and see if and open up the room for our Kenyan colleagues.
Hi, Charlotte.
Okay,
I've already opened up the room there.
Yeah, I just noticed.
Think if you are from Kenya, go to Telegram and join the live chat right now. And perhaps, Charlotte, to save time, I think scholars are perhaps very looking forward, interested in joining the country group discussion. So if there are other groups, country groups that you would like to have your own country meeting, just type in Telegram instead of on the Zoom chat so that both Charlotte and I know. Okay, back to you, Charlotte.
Okay, thank you, sir. So go ahead and do that. And I see we still have up to 91 persons right here in the Zoom room. So before you go, I'd like you to do one thing. I'd like you to invite you to do one thing for us again. It is to share the announcement for Teach to Reach Connector 6. To share the announcement for Teach to Reach Connector 6 on your social media handles. So I'm going to share the links once again in the chat. If you can go ahead and share with your network. And once you do that, type done in the chat. So once you do that, you can type done in the chat. So let me see. All right. So I just shared the link. I myself, I'm going to try to do that because I haven't shared anything in a while. So I'm going to share on LinkedIn, and I'll share my my screen, my LinkedIn handle. I'll share my screen for you to see exactly what I'm doing. So here we are on LinkedIn, and this is the announcement. So if you're on LinkedIn, you click on the LinkedIn link that I just shared in the chat. So this is the announcement. And the first thing I'm going to do is and I see we already have 3 shares. It's only 3. We are more. We are so many of us in the room. So please just go ahead and share. So I first of all like, and then I'll click on share. And I want to share, maybe leave a little comment. Do not miss. So I want to say, do not miss this incredible event. And so after doing that, and then I post on my LinkedIn handle. So just go ahead and do so. And once you have shared, whether it's on LinkedIn or on Facebook, can you just type done in the chat? If you have shared, if you share that, can you just type done in the chat? You do the same. You can do the same thing with on Facebook. And I can as well just go over to Facebook right now and also share the announcement for Teach to Reach Connect. So here we are on Facebook. And right now, I see so far we have only 3 shares. So please, let's do something about this. Let's show our platform some love. Let's share this with the members of our network. So I'm just going to share on my Facebook page. So I'll click on continue sharing. I want to share now with the public. So, okay. Thank you, Dr. Ndayo, for sharing it on Twitter and sharing your Twitter handle. So I'm going to go over to Twitter so that I can retweet from your own handle. And I want to thank Buka Alaji for sharing. That's done in the chat. Agre for sharing. That's you've typed done in the chat. Haruna typed done in the chat. Thanks to everyone that has already shared and that's continuing to share. Please, throughout the week, remember to continue to do so. so that others will come and benefit from the experience sharing. Thank you, Joy Ataudi, for sharing. And so let me check on Telegram. I see Nigeria. Okay, and I see some people have actually typed done on Telegram, meaning that they are also following and they're sharing. I see Ghana. The discussions are going on in the Ghana group, Ethiopia group, Kenya, India. That's wonderful. All right, so I really want to thank you all for joining today and for your active participation, and look forward to seeing you on Friday for Teach to Reach Connect 6. Really looking forward to June 17th. Looking forward to, and so many of you, you have received invitations for us, and we are continuing to receive the experiences that you're sharing, the insights that you're sharing through the form that we made available in the invitation. So if you have not yet responded, confirmed your participation, go to your inbox and confirm your participation by clicking on the link that was shared in the mails that you received. And one other thing we are going to be doing at Teach to Reach Connect 6 is that there are going to be photo stories. The photos that you shared during the World Immunization Week, we are going to be honoring all the photo sharers. We received over 1,000 photos. So there's going to be a special diaporama at Teach to Reach, a slideshow at Teach to Reach Connect 6, honoring, that is showcasing all of the pictures, the beautiful pictures that we received, and we'll be inviting the authors of those photographs to comment on the pictures, to share with us the context under which those pictures were taken. Immunization Agenda 2030, all the presenters, all those all on and those who are present right now, and those who are participating in their country meetings on Telegram right now.